Local health authorities. With me is Dr. Sherri Onyiego, representing Harris County, and Dr. David Persse, representing the city of Houston. This is sponsored by the Rotary Club of Houston. Thank you to past President Kathy Finninger. I am Stephen Williams, Director of the Houston Health Department. I'm going to start off with this text that I just got. I just received my first dose, which was Moderna, from HEB, and signed up for my second dose with the Houston Health Department because HEB didn't have any doses at the time. Is that okay with the health department?
Well, I mean, I think, yeah, I mean, the goal is to get people vaccinated. It may create an accounting problem and a tracking problem, but I'm sure this person isn't the last person to do that, and so we're going to have to figure out a way to make sure that it all keeps in track.
So the answer for you is yes, but it might create a tracking problem for the health department. Actually, your second dose is going to go to HEB unless it was formally transferred over. The city and county did a great job getting the vaccines out when received, even without advance notice. Is the number you are receiving still a mystery? Well, the answer to that, no, it's not necessarily a mystery. We know a couple of days before in the system how many doses we're getting. I think what is unclear sometimes is the actual delivery date, not necessarily how much we're going to get. The mega site vaccinated 3,852 last Saturday. This is impressive, but some places seem to have vaccines they haven't distributed. Are you able to get the undistributed supply from private facilities in the city and county, or sort of use it or lose it approach? Will there be another mega site this weekend? Stephen, you mentioned expanding to different parts of the city. When we get past this vaccine deal, then I won't have to answer questions. Yes, we are planning a mega site at Minute Maid this weekend. It is by appointment only. And the other question, no, you can't actually transfer a vaccine from one provider to another, but that needs to be done formally, very similar to the question that we answered first. And in fact, we have transferred vaccine to the county, but we notified the state that we were doing that so that the county would get that second dose and not us. Okay, next question. With only 3 hubs in the Houston area, people need to travel. Can you cross into other states if yours is more restrictive? Are we open to visitors from other countries?
Well, I mean, our state plan calls for us to be regional hubs, and so with that, we don't have any jurisdiction in terms of our region. But the state every state has their own plans, their own logistics. So, not from that standpoint, we wouldn't necessarily be able to do that, to my understanding. But
now, you will be able to really. You can't really turn anyone away. Basically, as hubs, we were required to say that we would serve anybody. I don't know that the question about other countries has actually come up.
Yeah.
Well, you said you can't turn anyone away, but that's based on those things. So some places, like Memorial Hermann, I just saw in the news last night, they're going to be having this large thing at NRG, but that's by appointment only. So if you don't have an appointment, they're going to turn you away.
Right.
But that's because you don't have an appointment, as opposed to your address is out of state or something.
right.
Absolutely. Remember, the overall goal is what 60, 70% vaccination.
70+%.
70+%. And so really, we want to ensure that we get to that 70%.
Right.
The distribution is expanding to retail pharmacies. Do you have to be their customer to get the vaccine through them?
No.
No, you don't. You don't have to be their customer to get it.
How can pharmacies have enough capacity to make appointments and keep people at safe distances? When people get the flu shots, the only pharmacist on duty stops everything to deliver the shot, and people waiting on medicine wait longer. When these places applied to be a distribution location, was that taken into consideration? Did they have to promise to staff up?
So my understanding is that, you know, the grocery store-based pharmacies, there are so many of them that, and how HEB does it may be a little different, Kroger from Randall's and so on and so forth. But the plan is that for each day that they will do some reasonable number of vaccines at each place. Now, whether they do it by appointment or not, you know, that's up to them to decide. But across 70, 80 grocery store pharmacies, doing 10 a day, that's 1,000. You know, you start, well, you get 100 of them at 10 a day, that's 1,000.
Right.
So,
But right now, the volume for the pharmacies is right around 100. Maybe some of them might be getting a couple of hundred more than that. But for the most part, the pharmacies are getting 100 a week, so that's not a whole lot of vaccines.
so even that's more than 10 a day.
That is more than 10 a day.
Yeah.
Now, the Defense Production Act was invoked for Pfizer to increase supply to the U.S. There seems to be more Moderna available in Houston. Why is that?
Well, I mean, my understanding is that, you know, Pfizer obviously was in the first wave, and a lot of that first wave distribution went to the hospitals and to entities that had the capacity to be able to store the Pfizer appropriately, because it really requires that special temperature control. And then the Moderna came out shortly thereafter to entities that certainly could be able to handle that normal storage capacity.
Yep. We keep hearing that side effects of the vaccine, though minor, simply show that the vaccine is working and your immune system is responding. What if you receive absolutely no side effects? Are you lucky, or are you in the 5% that isn't immune?
So I think this is some clarification. So with your first shot, if you don't have any signs or symptoms at all, that doesn't mean anything. In fact, I got mine, I had no signs or symptoms whatsoever. Now with the second one, you know, I'm expecting to get some fever, aches and chills, and some discomfort, because the first one will prime my immune system. If I don't have any of that, that doesn't mean that I didn't react. I just, you know, we'll have to, and here's another difference. We're seeing more, the older you are with the second dose, the less the signs and symptoms people seem to be experiencing. Younger people seem to be experiencing more with the second dose. I'm hearing this anecdotally. I don't know if you may have heard something differently.
Yeah.
So you know, it doesn't necessarily mean that you don't. You can't tell, basically.
That's right. I mean, I think we were having some discussions earlier today. Actually, the literature is saying that the second dose tends to be more sort of that time period where individuals may have side effects if they're going to get any. However, anecdotally, we've heard stories of individuals having some just mild symptoms after even the first dose. So, but it certainly doesn't mean that the vaccine is not effective just if anyone has no symptoms at all.
Okay,
I think that gets to the crux of the question.
Thank you for joining us with COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration for us, 3rd Ward to 5th Ward. We can't afford to lose this. It doesn't matter which state open first. We cannot allow this virus to get worse. Memorial, Main Street, A-Leaf, Acres, Home, Sugarland, and Sunnyside. Trust, we know it's hard to stay inside of your home, but you are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. River Oaks, West U Heights, Higham Park, Galleria to Greens Point. May we point out to you that keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. East End, 2nd Ward, Midtown, and MLK. And if we didn't name you, the same is true. We all have a job to do. Please wash your hands and get tested. It's time we invest in this great city, because where others may not have a solution, this is Houston. And we must protect the H.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist.
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más, para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Wash your hands, avoid sick people, and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Welcome back to COVID-19 Talk with local health authorities. Just got a text. As of 126, international travel rules require negative tests prior to boarding a plane. Should we expand this requirement to domestic flights?
It can, is it can or will?
Do you think we need to expand it to domestic flights?
Yeah, I mean, I think part of this is really geared toward the fact that we have the variants that are really sort of apparent across all the sort of so many areas across the globe, and I think that we're now seeing this variant in our in domestic areas, and so I think in theory and idea it makes sense. I don't know how much it's going to actually, stop some of the actual transmission that we're having, because U.S. in and of itself is a hotspot for all practical purposes. But I mean, I do think that it is a good step to sort of try to limit that. I think now that we have more vaccine, I think maybe that's some sort of effort that could be sort of approached by the airlines as well, to maybe using that as a strategy as well. But.
Yeah. I want to add on to that a little bit. So, we've got so much ground travel in the United States now, with people on buses and trains and in their
Cars,
automobiles, especially people who are afraid to fly, so they're driving. I don't know that it would have a big dent. And it kind of reminds me back when we were, after the rodeo, there were a couple of reporters who were, kind of grilling me and grilling us on questions like, why didn't you shut down the rodeo sooner, right? And the question, and they were saying, if you had done that, then, and they identified some small number of cases that theoretically came from the one officer, the initial officer who was identified there. And I told the reporter, I said, you're asking the wrong question. The question isn't why didn't we shut down the rodeo? The question is, why didn't we shut down the airports and the freeways? If you want to keep Houston protected from any virus at all, you have to shut down all travel in and out of the area, not just the rodeo. But to this question, with all that movement of people, doing it with the airlines, I think it just slow things down.
Dr. Hostez said Houston is not doing any variant testing, but the next day, Judge Hidalgo announced a new, more contagious strain from England. Comments?
Yeah. So that was, the CDC was doing random sampling, looking for it, and that's how that was found. Since then, the regional lab, the Houston Health Department lab, which is a regional lab, does have the ability to do sequencing, and we are doing it. In fact, we're actually taking samples that we had stored from back a couple months, and they're looking to see if they can find it. And as far as I know, as recently as a couple of days ago, we've not had any more cases. But you know what? The one case that we had was a gentleman, he had no travel history.
Right.
And so it's here.
Yeah, it is here. And I'll just also say that the CDC is also doing random samplings. They're doing it from vendors, lab vendors across the country. For the last several weeks, they've been doing those sort of random tests to really determine what the prevalence is of this strain across the communities.
My sister has MS. Should she receive this vaccine?
Yeah, so that's an underlying condition that certainly impacts the immune system, and one of the things that we continue to instruct the community about is to have those conversations with your healthcare provider, and individuals who are pregnant, individuals who are breastfeeding, individuals who have underlying conditions that impact their immune system are at far greater risk from the symptoms and from the severity of COVID than from the actual vaccine, and so we think that it's certainly worth having those discussions with their healthcare provider, but certainly that they should consider taking the vaccine.
A related question, can you confirm that pregnant women can be vaccinated?
Yeah, and so again, I think that it's worth having that discussion with your obstetrician regarding this, but I will say that the American College of Obstetrics and Gynecology has come out with a statement and a recommendation saying that the risk of a pregnant woman contracting COVID don't outweigh the benefits of them getting the vaccine. So they are recommending and advocating for pregnant women to receive the vaccine.
Okay. Our 80-year-old neighbor who is still working and around people all day has tried to sign up but said she is not quick enough to register. How can she get a link to register as her doctor can't assist?
Yeah. Well, this is clearly an example of one of the problems we're having. So I just did the math this morning, and the amount of vaccine that's come into the area divided by our population, it's still less than, it's still a single-digit percentage. So there's inadequate amount of vaccine that has come so far. And we just talked about a moment ago, as the neighborhood pharmacies in the grocery stores start getting it, as we, the health department, start getting more and can open up more, it'll be easier. So. It's very difficult for folks to get it. There's just way more demand than there is capacity in the system at the moment, mostly limited by the supply of vaccine.
Right.
And I talked a couple times ago, there's, consider 3 links in this chain: the amount of vaccine in the community, the infrastructure to be able to deliver that vaccine to people, and the demand. At any given time, one of those 3 links will be the rate limiting step. Today, it's the vaccine delivery. I hope we get to the point where there's more vaccine coming in than we can actually get into people. I look forward to that day. And I fear the day when we got more vaccine and more ability than people who want the vaccine.
If I get the vaccine, I heard I could still get the virus, but it won't be severe.
Yeah, I mean, here's the thing. We know that these virus vaccines are up to 94 to 95% effective, so it's not 100%. And so there's still a potential. I mean, we know that the most full immunity comes when you complete the 2-dose series, and effectively 10 to 14 days after you've received that full second dose that you truly have that true immunity. But again, 94 to 95% effectiveness is not 100% effective. And so again, we still have to continue those preventive measures that we continue to talk about until enough of our population is effectively vaccinated.
The other thing is that the studies looked at people who became symptomatic.
Absolutely.
So there is the remaining question of, did people become infected but they were asymptomatic?
Right.
And the studies are being done now to look to determine how much that may, and it's, I'm anticipating the number won't be 0, that there will be some of that, but even then the next question is, they didn't get symptomatic, they didn't get sick, they didn't require hospitalization, that's good. Were they infected enough that they could then spread it? That is a separate question, which is being looked at. We'll get an answer within a couple months, I think. Okay,
I have a friend who said vaccines aren't the only protection we have. You can raise D3 levels, vitamin C, and this quercetin that acts like hydroxychloroquine when taken with zinc. Please comment.
So
I had to give y'all that one.
So when I've looked at this, and I'll tell you right, I've looked at it because I'm like a viral magnet. I get 2 colds every year, right? And so I've looked at this, and I've looked at the literature, things like zinc and vitamin C in particular, and a couple of the others. And quite honestly, the literature is kind of iffy on it. In some studies, it looks like these things may be of benefit. In others, they say that it's absolutely no benefit at all. And in the ones where they are benefit, here's the thing that you got to consider. In some of those ones they say it's of benefit, the doses that you have to take are really high. And the problem with that is that there are then side effects from that. And so I think at the regular normal doses, I suspect it has no impact. At really high doses, it maybe is beneficial, but you're definitely going to run into some of the side effects. I don't know.
I agree. No, I agree. I think that one of the things that we have to continue to tell people that if they're going to do dietary supplements, that's one thing. The best way to get a lot of the helpful nutrients is through the diet. I mean, I think keeping our immune system as healthy as possible with rest, hydration, sleep are going to be some of the key metrics that we do. And again, a lot of things aren't solved by a magic bullet or a magic pill. I mean, we still have to really talk about those preventive measures that we do know that are in our toolbox right now. And again, it's wearing the mask, watching your distance, and washing those hands. I mean, those are really the effective tools that we have right now as we're waiting for more vaccine to really come to our community.
No amount of vitamin C takes the mask off.
Yeah.
Thank you for joining us with COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
Day after day, we set our little routines. Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat. For our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Oscar the Grouch here to tell you, to wear a mask out in public around other people. Sure, it'll keep you healthy, but more importantly, I won't have to see your happy, smiling face. And if you don't want to wear a mask, I've just got one thing to tell you. Scram! Go away!
Caring for each other because we are all in this together.
So wear a mask and have a rotten day, will ya?
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Food. It brings us together, inspires joy, and gives us life. But we can't forget that during this crisis, over 37 million people don't have access to nutritious food. That's 1 in 12 seniors and 1 in 7 children. In fact, millions of kids aren't able to receive a free or reduced price school lunch right now. The good thing is, we can all help. Learn how you can get involved at feedingamerica.org. When we help each other, we nourish ourselves, our families, and our communities.
Welcome back to COVID-19 Talk with local health authorities, Dr. David Persse and Dr. Sherri Onyiego. I've always been told that viral infections have to work their way out of your system, and medicine only makes you feel a bit more comfortable.
Well, I mean, I think one of the things to keep in mind is that viruses do, I mean, we have the common cold viruses, we have so many viruses that circulate, and for the vast majority of folks, they can just run their course. However, individuals who have underlying conditions, you know, a weakened immune system, they can be more subjected to the harmful effects of a virus, and then the virus can then complicate things by causing things like a bacterial infection, and so then additional therapies are needed, which can make individuals more, you know, have a more difficult course. But for the vast majority of folks, you know, viruses tend to run their course.
Will vaccines give longer immunity than having the virus?
So that's one of the things that's being studied now. And it's theoretical, but one of the theories is that yes, it will. But you got to be careful because depending on how it appears right now, it appears that how sick you got when you had the virus sort of determines a little bit to some degree how long your immunity. So some people have very mild illnesses. We're saying they're only having antibody production for about 9 months. I'm sorry, about 90 days, which is 3 months. And others who are really sick seem to be having it longer. With the vaccine, it'll be more predictable.
Right.
Is it accurate to say no live virus is used in any of the vaccines currently in trial?
In trial?
In trial,
I think there are some live
I think there is some in trials that are in the pipeline.
Yeah.
But what we have authorized right now, they don't use the live virus.
But an important thing to understand with those live virus trials, those are generally not the coronavirus that we're worried about, although there is a way to take wild virus and make it not as not lethal, not as bad, but there's also a way of taking other viruses and injecting some of the RNA that makes the spike proteins, and so that's a very, actually that's a complicated question.
Right.
Okay, Moderna is starting phase 3 trials for ages 12 to 18. What about under that age? And their CEO says that their vaccine could potentially offer protection for a couple of years. How do they know this?
Well, what I know is that they are working on that age range. They're doing those studies right now in pediatrics. But 12 years old and younger, those studies are going to happen down the line, because part of it is that you have to use a lower dose. Because it is a younger population, a more vulnerable population. So those studies are projected to take more time. They do want to go ahead and get that age group of 12 and the adolescent, because I think that's the age range that we certainly want to be concerned about as far as schools and reopening that portion of our economy and getting kids back safely. So hopefully we should know about those results, I think fall 2021. From those trials.
AstraZeneca efficacy is listed at 70.4%. With the first 2 vaccines higher, why would we want to use one that has lower efficacy?
Well, one of the reasons is that the AstraZeneca is far less expensive, and so maybe here in the United States we won't see as much of that. Perhaps we will. Right now, you know, to the consumer, the federal government's paying for it, so it doesn't have any. But think of third world nations that have got really poor economies. This will help them, and that's important to us because this is a global pandemic, which is a redundant term. So we want everyone on the globe to be vaccinated if possible.
Are the hopeful dates for J&J at the end of the month and AstraZeneca at the end of February or early March? Do we really know?
Yeah, I mean those are the projected dates that I've heard. I mean, I think it's going to depend on sort of how the rest of the data shows, and then how the actual approval and the review and the authorization process goes.
Related question: do messenger RNA vaccines like Pfizer and Moderna get faster approval because they use the body's own cells?
No, they don't get faster approval. They just really get it's easier to generate large amounts of vaccine with the mRNA process than with the other more traditional ones.
True.
And so they just got to that point in the trials faster.
Okay, this is about transmission. 17.4% positivity rolling average. How are hospitals handling it?
Yeah, what we know right now is that our hospitals, at least in the TMC, are past their phase 1. They're in their phase 2 of surge. So we certainly are concerned about all of the metrics, positivity rate, cases. We're seeing like more than 2,000 cases per day. And then we know that what we see in the community ultimately translates into what happens in the hospital. So,
if a person in your home tests positive, why is the isolation period only 14 days when that person is at home is contagious for 10 days? Is it?
Well, the isolation is for 10 days. Well, actually, it's until all of your symptoms are resolved, and but generally it's around 10 days.
It is.
And the quarantine is 14 days because we know some people will not develop symptoms out until at least day 10 or so. And so they're true and unrelated kind of.
The flu is different each year. Do you suspect that COVID will change each year? What is different about the flu and this virus?
well, I think historically we know that the flu changes, and that's the reason why the vaccine has to respond to the different sort of variants of the flu. I think it's really early to tell what's going to happen with COVID. I mean, we have taken some, with COVID-19 or with SARS-CoV-2. So we've taken some notes from what's happened with MERS and with SARS, but I think it's going to be a little bit early to tell, but hopefully we'll be able to know something about that soon.
Well, one important thing about it is remember that with the flu, it not only affects people, it infects animals, birds in particular. And every time something is infected, it has the opportunity to mutate and change. And that's what happens with the flu. With COVID, since it's predominantly in humans, if we can get the globe to be vaccinated, right. It will. You know, I don't foresee in the near future the time we completely eliminate it from the surface of the planet. But if we get the number of humans that are infected down really low, the chances of mutation and requiring different vaccines becomes much, much lower.
And this question, are these COVID vaccines changing the way we look at virus? I think it's influencing it a lot.
Absolutely.
Yeah.
Absolutely.
Diphtheria, tetanus, and pertussis vaccines are long-lasting and address bacterial infection. Polio, measles, and smallpox are viruses and do not mutate. Where does COVID fit in? Well, COVID is mutating.
Man, we've seen it mutate.
Yeah, we've seen it.
And it's the same thing. The more people that are infected, so there's very little polio on the planet today, right? And but there's lots of coronavirus, so a lot more opportunity for it to mutate.
Right.
Okay, once the vaccines are no longer emergency use, shouldn't we require those working around patients to get this vaccine?
Yeah, I mean, I think that we're going to likely have to have some sort of policies surrounding that. I mean, we've done that for flu in the healthcare systems, and so I think that that's certainly going to be something that we'll likely have to.
Yeah. Which of the vaccines can be made quicker? Do we know that?
The mRNA vaccines are made the quickest. Yeah.
Can you explain antibodies, helper T cells, and killer T cells?
So the best way that I can explain it is. The T cells are kind of like your army. So if you think about your army or your soldier cells, those are the T cells that really sort of come up, they wake up, and they're the fighter cells, if you will, to really help to build up your immune system. The memory B cells are the cells that sort of have that sort of innate memory to be able to recall and say, oh, I remember what that looks like. They see that foreign piece, and they are like, oh, I remember what that looks like. So they work in concert with one another. So the T cells activate the B cells to remember, and then those T cells are certainly the soldier cells that help to keep our immune system strong.
Okay, thank you for joining us for COVID-19 Talk with local health authorities from Harris County. We have Dr. Sherri Onyiego, Dr. David Persse representing the City of Houston. We want to thank you to Rotary Club of Houston and past President Kathy Finninger for providing these questions. I'm Stephen Williams, the Director of the Houston Health Department. See you next week.